We are continuing our mom-founded series here today in Aberdeen, New Jersey at the Rejuvenate Center for Medical Aesthetics and Wellness with Dr. Falguni Patel. Thank you so much for having me.
Well, thank you for coming.
Yeah, I'm excited to learn more about you. We've been working together for a little bit now, so I know about some of the services that you offer. You have a practice here in Aberdeen and then also in Lake Como?
Yes, correct.
Okay. Tell me, where are you from?
I'm from New York.
Okay.
But I've been in Jersey now for 30 years.
Oh, wow.
Yeah, I live in Homedale with my 2 kids.
And how old are they?
My daughter's 18, going off to college in a couple of months, and my son is 15 and a half.
So all the cycles of motherhood, the teen years.
Oh, yes. The heartache years.
They are. We don't talk enough about it. I think with Mammoth Moms over the years, I've really tried to emphasize the different cycles of motherhood because I've said this many times. I was a young single mom for a long time, and then was remarried and had my daughter. And a lot of the content sometimes is, oh, mommy and me classes, and we want more of this, but the moms of teens need resources too, for sure, right?
You do. I mean, the open communication with your teens is so important, and people think, oh, they're independent and you can focus on your work more, but I'm actually the opposite. I work less now, knowing that I find it's important to be home when they get home.
Totally.
In case they want to talk about something, it's like the perfect time. Let it out.
My mom always said the best time to talk to a teen is when you're driving. But they'll they'll talk a little bit more when you're not looking at them in the face. But I've even noticed that with my 9-year-old too. Like coming home from school, we'll chat about things. So you lived in the city, and when did you move here? 30 years ago.
I grew up in Queens. Most people don't know that. I then went to City College and then Mount Sinai School of Medicine in Manhattan. So I lived in the city until I was, 22. Then I did my residency a year in Philly and then came back to Jersey, and then I've been in Jersey since for almost 28, 29 years since.
Oh, okay.
Yeah.
What part of Queens?
Woodside, actually.
Woodside, okay. So my mom grew up in Jackson Heights.
Okay, not far.
But I don't know Queens very well. My grandparents lived in Jackson Heights and they moved to Red Bank when I was probably 10. So I don't know it well, but we went back for a week last week and she was showing me all the different neighborhoods, and one is like very close to the other. It's kind of like being here. It's just like more built up, you know?
I actually honestly have not gone back in probably over 10 years. So I've heard from many of my patients that it's changed a lot.
Yes, a lot, yeah. Not easy to get there
either. No, my parents still have their friends out there, but more in Long Island area, and the commute is horrible, but they do it.
Right. So you graduated from medical school, and what did you start out practicing?
Well, after graduating medical school, it's 4 years of residency. So I did a year in Philly, and then I did my 3 years at Robert Wood Johnson, New Brunswick, in OBGYN. Oh. And then got married, started a practice in Summit, Westfield area. I was there for like 5 years. Eventually took a faculty job with Robert Wood again for another 4 years. And after that, I realized that it was time to start my own practice because I needed the flexibility of being off when I needed to be off so that I can, raise my kids.
Right.
And still be a doctor.
So let's lean into that. So how old were your children when you started your practice?
My son was 2 and my daughter was about 4, maybe 4 and a half. And that was one of the reasons I started my open practice, because the faculty position I had just required me, I speak 2 different Indian languages in addition to English and some broken Spanish, medical Spanish. So they needed me to cover some later hours in clinics, and quite frankly, that meant that by the time you wrap it up and come home, so I realized that I'm not going to have another 2-year-old again. He's not going to be 2 again, and my daughter's not going to be 4 again.
Right.
And I had a supportive spouse at that time who financially said I can quit my job and start my own practice. And I decided to do that, and it was the best decision I made for myself.
Yeah, so you're right, you don't get those years back. Being a working mom is challenging regardless if you're working 2 days or 4 days or 18 days a week, but if you're...
And there's a lot of guilt, even if you work 2 days, but you work 2 full days, you just feel like you miss moments in their life.
I remember when I went back to work with my daughter, My mom watched her the first year, and it was really nice to have that because she would send me pictures of things that she was doing throughout the day. She ended up going to daycare, and she had a lot of separation anxiety.
You just have to learn to balance it. I mean,
Right.
I did put my kids in school that early for a good 4 hours, 5 hours a day. I think it's good for development and socialization.
Right.
But those were the hours I worked. So, and to this day, I only work about 20, 22 hours a week because at the end of the day, well, my daughter will be off to college in August, and my son, I have another 2 years left with him before he's gone. Once they're gone, I can say, all right, if I need to work 40 hours a week, then I can, but 20 hours, you make do with what you make at that point because it's the perfect balance. When I first started my practice and I was working very limited, my father's like, you're not working your full potential. And I said, well, what is my full potential? My full potential as a woman is to be a mother, a friend, a doctor, the whole package. So I'm working full potential. I don't need to be working corporate America 40 hours a week. Europeans don't do that, so why should I?
You worked hard to become a doctor, right?
Our education system in this country, it may be great, but it is quite expensive. And by the time you come out of medical school, the average person is in $500,000 debt. So when you come out with so much debt and then you choose to do part-time, well, how do you pay your debt back? You eventually do.
These years are precious, and how the older you get, how quickly 2 years flies by. But it is true because now I say it where it just flies by somehow.
It does.
And you don't get the time back. So if you can find an opportunity for yourself that allows you to fulfill your that emotional paycheck that you get from your role within your work, allows you to be present as a parent. I think that's the biggest win as a mom. So tell me about what it was like building your practice in the beginning with little kids.
By the time my son was in 2nd grade, he had the nerve to tell his teacher she needed Botox. What it means to start your own practice with little kids is that your kids are in the office all the time. So
right.
After their school, they would be picked up and then they hung out here with me on the days I had evening hours. Kids at that age absorb everything. They start to read, they absorb, and they spit it back out to their friends and their teachers. It wasn't as challenging as I thought it would be. Financially, like I said, I had a supportive spouse, and I didn't need to bring in the money I was bringing in before as a faculty member. So it really gave me a chance to build up my practice to the way I wanted to.
And it's about 14 years then?
Yes.
Right? Okay. So 14 years ago, this was Botox, and a lot of the services that you offer were kind of in their infancy in terms of you were pre, where now it's much more prevalent, and you hear about these services offered throughout.
In my previous 2 practices, it was a cosmetic-based hybrid practice. So I'm board certified OB/GYN, but I'm actually a specialist in pediatric and adolescent medicine as well. And then I've gone through my certifications in anti-aging medicine and menopausal stuff. So there's a lot of little stuff here and there. When it comes to cosmetics, in my first practice, we did a lot of laser hair removal treatments because it was hand in hand with all our polycystic ovarian syndrome patients, which is PCOS, for young women with excessive hair issues. That is how the cosmetic portion started. And then the other big portion was vaginal rejuvenation surgeries, which has been around for decades, but very hush-hush, and not as many patients did it. But once again, in my first practice is where all of that stuff started. When I opened my hybrid practice 4 years ago, it was like the perfect platform for me to say, all right, I'm gonna still practice my bread and butter medicine, but I can build the cosmetic platform based on what suits me.
So what services do you offer now?
Well, I'm still a general gynecologist. I don't do obstetrics. That was something I retired from in 2016, just because I didn't want to miss moments with my children. The gynecological half of my practice is from well visits. I do consults on all female children of all ages because of my adolescent pediatrics specialty. Menopause is a big thing. Most of my patients are in their 40s, 50s, and 60s, coming in for their changes. So I do hormone management, both pellets and creams. So that is the gynecological. Oh, and the biggest part of my gynecological practice is, of course, the vaginal rejuvenation surgery, which I would say at least a third of my patients travel to come to me, whether it be from the northern states or the southern states. I'll have patients coming in from California, and then we have a lot of patients that come in internationally.
Wow.
We don't have any great hotels in our area. It's limited selections for many of my patients that come expecting some beautiful places to stay in while they're recovering. And
Molly Pitcher again.
Molly Pitcher is where most
Yeah.
of them end up
Okay.
going to. In the hotel business, it's time to open up a nice posh place in the area.
Bella Works is still considering it, putting it on
Yes,
the roof.
I ask all the time. That would be ideal for our patients, but it has not happened yet.
You're right. We do need a hotel. Noted. Any
Yes,
moms out there?
and these are patients that are paying for it's basically plastics of the vagina,
Okay.
which is what I'm doing. And they come to me because they know I'm kind of one of the best that does what I do. So they would want the same places to stay in, So
Yeah.
I know. So
Understood.
they feel like that's a step down half the time from where they're staying at. But most of them are distracted by my team, and they're so happy when they are here that they don't really focus on where they ended up staying in a hotel.
Yeah, it's beautiful. The center's very well designed. So what is the rejuvenation exactly? Why would someone need that, and what happens, and how do you help them?
It depends on which facet of life you're from,
Okay.
and also, who you are, in the sense that there's many vaginal rejuvenation surgeries that I do. Just to list them, there's labiaplasties, clitoral hood reductions, vaginoplasties, perineoplasties, hymenoplasties, and non-pubis lift, to name a few. When and where? So for the average woman who has had maybe 2+ vaginal deliveries with the average size baby of maybe 7 pounds or more, it may not be the same down there. And if you look at maybe our mothers or our grandmothers' generation, sexual satisfaction wasn't the main focus. It was more about marital satisfaction or being intimate with your partner, but not necessarily the same way.
Mm-hmm.
And I feel that nowadays women feel that they need to be empowered in their bedrooms just as much as the men do. And women are seeking out surgeries to correct some of the wear and tear that happened with childbirth.
I see.
So that's one portion of vaginal rejuvenation. And depending on where they are in their childbearing and how many more kids they have, there's non-invasive options and invasive options, surgical and non-surgical options. So that's one aspect of it. So most of my vaginoplasties, perineoplasties are women in their late 30s, but predominantly 40s and 50s. These women are doing it for numerous reasons. One is just to keep their marriage as spicy as it was when they got married. And I would say a good 50% are doing it because they actually just went through a divorce, and being single back in the market is not really easy. So if they feel whole again, where they feel like they're back to their pre-children self, they just feel a little bit more confident meeting people.
Right.
Okay.
I think too, the recent, I don't know if you saw the reality show or at least advertised the Golden Bachelor. There are a lot of women that still want to, find love and find, fulfillment within a relationship, and I'm sure are seeking out all kinds of, ways to be more confident, right, as they're in that part of their lives.
And our society has accepted breast augmentation and tummy tucks for decades now.
Mm-hmm.
And I think women are more seeing that when they have their breast augmentation and tummy tucks done, they are lacking down below. They don't feel like it matches the rest of the stuff that they did. This is not a surgery that every woman needs to do. It's really if you feel that that you're missing something. It's like breast augmentation. Every woman does not need to do a breast augmentation, neither a tummy tuck, but some of us will feel uncomfortable and will seek something out. And this is just one other surgery that's out there that patients sometimes don't realize exists. Labiaplasties is the other major surgery, which predominantly the patients are younger. Labia minora is the inner tissue to the female general organ, and they come in all different shapes and sizes. However, when girls start college and they're in the showers together or in the bathrooms and they see one looking different from the other, and now it's very easy to find information on social media, many women are coming in asking for that procedure to make them smaller so that it's not sticking out in their bathing suits, or it's not rolling into their tights as they're working out. So there is definitely a discomfort thing. You know, many people will say, we have no idea what you're talking about, or why are you encouraging women to mutilate themselves? What I tell people at that point is that you have something that's very comfortable. She does not. So it's we can't judge why somebody's feeling what they're feeling unless you were in their shoes. And you know, if I were to see 100 vaginas in a week, half of them are larger labia minoras and half of them are not. But that doesn't mean everybody that is larger is uncomfortable. You know,
is that like what people say when it's like camel toe? Is that
yes?
Okay,
well, you know,
yes
camel toe is funny. Yes and no. Some people refer to that as a camel toe, and usually that's it. But I have, you know, you've heard the term fupa, right? That I've had patients come in and refer to that as their camel toe. So I never thought growing up that that was what people refer to as camel toe, because that's like the pooch, the mons pubis pooch that's kind of sticking over. But it's really, when people talk more about camel toe, it is the labia minora sticking out.
Oh, that's interesting. If you don't feel comfortable, and you know, maybe you try on 10 pairs of pants and 7 of them you don't feel comfortable because of the way that you look in that, and it makes you self-conscious. You don't want someone staring or thinking that there's, you know, that you're staring at that area of your body, right? Which is obviously very private to a woman.
Or many people think it's a very simple surgery to do, but it's not. And there are not that many qualified surgeons out there. I mean, if I had to look at Jersey, maybe there's 5 to 7 of us qualified to do those procedures. A lot of people market it, but the question is, how many are they really doing? My center, Wednesdays and Thursdays, is predominantly surgery. That's what I do.
But they're done here?
Yes, unless they had they're morbidly obese, smoker, hypertensive, medical issues, then I would do them at the hospital. But most of my patients can be done under local anesthesia. So when I mean local, a block in the vaginal area, a pudendal block, and they can be done in my surgical room in my office.
Wow.
Yeah.
Okay. I noticed that you offer weight loss management. Yes, and glutides. Thank you. You know what that process is for a patient that comes in and you know, perhaps is interested in it.
Weight issues is always an issue for every woman. Over the last 2 to 3 years, as the Wegovy and the Ozempic and the Mounjaro and its generics like the semaglutide and the tirzepatide came on board, the reason we are not a calorie deficit program is because the rebound rate, if when you stop it, you're going to put at least 50% of it back on. If you train your body to start eating healthier during this process, the success is a lot better.
Oh, that's so interesting. I have friends that have tried different things, but then they do end up, you know, going back, but they have to have some type of like, you know, plan, right? To be able to have consistency and
right, because if you do calorie deficit, you will lose weight a lot faster, but you will not be able to maintain it. So our weight loss is a lot slower, and it's more conducive to a lifestyle change.
Because that's the biggest piece is, I know like the Ozempics, I believe they have like a 15 to 20% weight loss, but that's where it caps, correct?
I mean, we have a patient that's over 100-pound weight loss right now, so it's just a question of how slow and steady you do it.
Interesting.
Yeah. Okay. And we do monitor with labs, so depending on what their initial were, if there was anything off, we would repeat it in 3 months. If they were absolutely normal, then we would wait 6 months to maybe even a year to repeat their blood works just to see where things are going.
Oh, wow. And then other services you offer, you know, Botox, Morpheus.
You know, the traditional cosmetic stuff, they kind of go yin and yang because, you know, as I said, I have a lot of perimenopausal, menopausal women who aren't feeling great about themselves. Once we start correcting stuff internally where they're just kind of more energized and they're feeling good, that's when they start to trickle over to the other side and want some of the exterior to match their mental happy state. And that's when the Botox, the fillers, I have two injector providers. Deanna, she is almost an NP in a couple of months. Gabby, she is my nurse practitioner as of this year, but she's been, both of them were with me for a while, trained with me, and they are exceptional, aesthetic providers. We do everything from Botox to fillers to lasers and microneedling, radiofrequency treatments, liquid facelift, as I call them, YLIF.
Liquid facelift, what's that?
It's basically a combination of fillers and tox,
Okay.
and
All right.
sometimes skin tightening to kind of give them what they need.
Okay, interesting.
I have 2 estheticians here who do the VI peels, microneedling treatments, hydrofacial, diamond glow. So, pretty much from something as benign that many of our teens come to something much more aggressive that even my 50s, 60s, and 70-year-olds come to.
Do you treat teens for weight loss management?
It was cleared a couple of years ago for a 12-year-old. We have a handful of teens that do come to us. Teens are taken very differently than an adult woman, and it just depends on the age. So my teens, I don't have anybody younger than 16. I feel like any younger than 16, I'm not sure if I feel comfortable understanding their psyche, like where they're coming from and what's going through them. So I do sit down with them, and when I mean I'm a pediatric adolescent specialist, I deal with predominantly gynecological issues with all the young teens and even unusual stuff, in a 2 or 3-year-old female patient. But when it comes to weight loss, it comes down to how long their weight has been there, what is it that they're trying to achieve, who recommended the weight loss to them, themselves, their mother, a friend, social media making them worse. I kind of really delve into that. I actually ask to see their social media platform.
Wow.
Because I want to see what kind of activity are they doing. And I do recommend that they shut the noise out by possibly just stopping social media for a short time while they go through their changes so that they're not influenced by whatever they see out there.
Jennifer Garner has been famous for implementing that her children not have social media even through their teens. I'm sure it's tough to stick to.
My daughter actually didn't open her social media platforms until earlier this year, and I didn't want her to have it as a teenager, and she was actually pretty mad at me because last year I said, you're a junior, you're allowed to have social media, and she's like, screw you, Mom, I'm too late in the game, I can't open up a platform. Who gives a crap's ass? I said, you can create your platform of the adult you now. Whereas my son silently opened one without me knowing. By the time he was 11 or 12 years old, I discovered it, and I was just like, what are you doing? I basically said, well, if you're gonna have that, I'm following you. And he's like, no, you can't do that. I said, but I will. Either if you don't want me to follow you, then you're gonna have to sit down and go over it with me. And I wanna make sure that you're in a safe zone and that you're not dealing with morons.
My son just followed me last week. Finally, he just turned 20. I said, "Oh, you're not a teen anymore. Now you'll follow your mother. Thank you so much."
My platform is just my business platform, which I try to, but Alexis, who's my practice manager, does that predominantly. But a lot of my kids' friends follow me, and my son's friend follow me, and that just worries me. Because I say stuff that is inappropriate half the time, and you don't need to be listening to it. So,
right. Oh, that's funny.
Yeah, it is what it is.
So as a mom of teens, as a business owner, as a doctor, what has been the most challenging part of being a working parent?
The challenging part is not disappointing them. Both my kids are athletes, and when I used to miss games, especially if they did something great and I wasn't there, there's just a lot. You sometimes feel it.
Even if Dad was there?
His dad wasn't always there because he is a physician and he was working way more than I was, because that is why he financially let me quit my job and start my practice. So he was kind of almost overcompensating at a point, so he wasn't around much. And so I felt like if I wasn't there for my kids, maybe it was more pressure on myself, so I would look back and say I'm not a good mother. The most challenging is to give myself positive reinforcement to say, no, I'm the best that I can do, and I just have to learn to use the resources around me. So my parents helped a lot, and my sister helps a lot. She's in IT, so she can work from home, so she comes and helps a lot.
And she lives nearby?
So she lived in Dallas for a while, and she's back in Jersey, so yeah, she's nearby. So now she doesn't have to come to babysit my kids, obviously, but she comes to babysit my dogs.
And what have been some of the triumphs? Your daughter's nearing college.
We just came back from Case Western last week, so she's gotten into quite a few good schools. You know, Northeastern, Case Western Reserve in Cleveland, Ohio. You know, UPenn Honors. She's on wait list for a lot of different schools. You know, from BU to Wake Forest to UC San Diego. She doesn't know what she wants to do anymore. They're great schools. She's got some great options. She even got into Seton Hall's 7-year medical program, but you know, she wants to follow in my footsteps, but I feel like you need to, you know, forge your own path and go live a life first. So I'm encouraging her to leave Jersey, and at this point, the challenge is trying to help your child make their own decision, but also help them in making that decision if they need you. So we have a week to finalize her decision. So
do you think she's leaning towards one or the other?
No idea. The Northeastern one is actually really nice in the sense that she gets to go to London. It's the London Scholars Program for a year. Who doesn't want to go to Europe? My child loves Europe, so she loves to travel. So I think that would be great. But Cleveland, Ohio, you know, Case Western Reserve is next to the Cleveland Clinic. So if she really wants to be pre-med, then you can't ask for a better place.
Right,
so,
right.
I don't know. I have no idea.
Okay.
I guess we'll see next week what she decides.
Well, you'll have to let us know.
Yes, because she sure as heck is not posting anything on social media for me to see.
They do like the big reveals now, right?
Yeah, and most of her friends have. I know Alexis does the posting for me, so as soon as my daughter decides, I'm sure I'll let Alexis know, and she'll post something on our Instagram and our Facebook page.
Well, good luck to her.
Thank you.
Thank you for sharing your story. It's incredible how you've built both practices, how you have raised your children to be, it sounds like really, really great kids. So
they are good kids.
Yeah. And you're offering really great services to women that, you know, that need it for all kinds of different reasons, and all kinds of vaginal rejuvenation, to weight loss management, to fillers, Botox, and more. So you can come here and feel confident and you know, your best self, right? You determine who that is. So and where can everyone find you?
Well, our website is rejuvenatenj.com. It's pretty easy, not the ridiculously long name that I have. My first name, Falguni, is not very common. Patel is very common, so if you look up Dr. Patel, you will never find me. Dr. Patel, he's a good guy, but you could also do FalguniPatelMD.com.
And we'll link everything here.
Yeah, you can look us up. And I think our Instagram is also RejuvenateNJ.
Yes.
So it makes it easy. Our main one is in Aberdeen, and we have an office in Lake Como, which we opened last year. It's a much more modernized office. It's mainly our aesthetics. We actually have a huge IV lounge there for all the IV vitamins and stuff. So,
I've yet to try that. I've got to put that on my list this year.
You know, if you're a big drinker, it's really more important. If you're a big traveler, it's very important. So this is why we do it at both of our offices, but we created like a whole section over there just because it's a lot more 20s and 30-year-olds living out there.
Right,
yes, and you know, drinking IV hydration before or the day after, it really helps perk people up.
Yeah, I'll have to give, next time we go out, I don't know when that's going to be, but
with little kids, you never know, right?
Yeah, I'll have to come by. You offer it here too?
Yes, we do.
Okay, I'm right down the street. So
anytime you need it.
Well, thank you for having me. Thanks for sharing your story, and I look forward to learning more.